Hello and welcome to another episode of EKU Online's eCast series. EKU Online's mission is to change lives by providing access to affordable and high-quality degree programs in meaningful disciplines that positively impact our society. We thank you for joining us today. Today, we are joined by Dr. Angela Wood, clinical faculty in the Family Nurse Practitioner Program in the School of Nursing here at Eastern Kentucky University and the College of Health Sciences. Dr. Wood is a nurse practitioner and is board certified as both a family nurse practitioner and pediatric nurse practitioner. She joined the faculty at EKU in 2014 and serves as the clinical coordinator of the Rural Health Family Nurse Practitioner Program. Dr. Wood earned her associate and bachelor's degrees in nursing from Midway College. She completed her Master of Science in Nursing degree as a family nurse practitioner from Eastern Kentucky University in 2001. And a postmaster's certificate as a pediatric nurse practitioner from Spalding University in 2006. Dr. Wood completed her Doctor of Nursing Practice degree at Eastern Kentucky University in 2017. As a full-time faculty in EKU's Family Nurse Practitioner Program, Dr. Wood serves as course leader for the first 3 clinical courses in the FNP program. In her role as clinical coordinator, Dr. Wood is responsible for coordinating clinical placements for students enrolled in the Rural Health Family Nurse Practitioner Program and works closely with students to ensure they have excellent clinical learning experiences. Dr. Wood is an award-winning educator. In 2019, she was part of a Family Nurse Practitioner faculty team receiving the International Blackboard Catalyst Award in teaching and learning. Welcome, Dr. Wood. Thank you so much for your time today. We genuinely appreciate it.
Thank you, Sam. I'm glad to be here.
So let's jump right in. As we begin our discussion, Dr. Wood, please define for us Family Nurse Practitioner, or FNP as it is often referred to. We're used to hearing the term nurse or doctor, but can you tell us exactly what is a Family Nurse Practitioner?
Yeah, a nurse practitioner, is an advanced practice registered nurse, or APRN for short, who is first a registered nurse, or RN, that has received an advanced practice nursing degree, either at the master's level or doctoral level. The educational preparation is focused on a specific population, such as family, pediatrics, could be geriatrics or acute care, but a family nurse practitioner, or FNP for short, provides primary care. This includes health promotion and disease prevention. It includes treatment of acute and chronic conditions for patients across the lifespan. So that can be infants, children, adolescents, adults, and seniors. Skills for an FNP include things like obtaining a complete medical history, performing physical exams, ordering, performing, and interpreting diagnostic tests, prescribing medications, developing treatment plans for those acute and chronic illnesses or conditions and injuries, and then, maintaining patient records.
Dr. Wood, why study this discipline? What's the career job outlook like for family nurse practitioners?
Well, according to the World Health Organization, in 2020 was the year of the nurse. The pandemic highlighted the importance of nurses in healthcare, including advanced practice registered nurses, APRNs. According to the American Association of Nurse Practitioners, 75% of nurse practitioners are actively providing primary care. There's a shortage of primary care providers, and family nurse practitioners step in to fill that gap. We increase access to care and by providing primary care services to those underserved and the people in rural areas. Family nurse practitioners are often the first and only point of care in their communities.
And can you explain to us, Dr. Wood, where do some of our graduates work today? With the program completely online, what do the demographics of your student population look like? And in other words, what kind of students is the program attracting?
Well, as FNPs graduates, they have a very broad scope of practice, and there's opportunity to work in a variety of healthcare settings, including like community health centers, private practice, healthcare systems and universities. Specifically, the types of primary care settings include family practice, internal medicine, urgent treatment centers, retail clinics, such as your little clinics or minute clinics. Other employment opportunities include school-based clinics that utilize nurse practitioners. Our graduates also work in pediatrics and women's health, since this is included in the educational preparation and within our scope of practice as an FNP. Our scope of practice includes a variety of populations, and FNPs can move into specialty areas with further training. This can vary from state to state, but in many states here, such as in Kentucky, FNPs can also establish their own private practice. And to answer the second question about demographics and our student population, first we got to think about the history of our program. EKU's Rural Health Family Nurse Practitioner Program, we began as a bricks and mortar program back in 1995. But to better meet the needs of our students, the program transitioned to a 100% online program in 2013. We draw students from our service area of Central Kentucky and Eastern Kentucky, and that includes, rural and urban areas. Since our program transitioned online, we've had students though from multiple states. Our students are experienced registered nurses or RNs who want to advance their education and move into the provider role. They're motivated to help fill the gaps they see in primary care. They want to improve the health of people in their own communities because as registered nurses, they're seeing the health problems that arise out of the lack of access to care and the lack of health promotion, disease prevention.
Dr. Wood, how would you respond if a student asked why they should enroll in the Family Nurse Practitioner Program here at EKU when there's so many other options in the medical field?
Well, there are a lot of options, in the medical field, but students who enroll in our program, as I said earlier, are already registered nurses with experience. Students build on their existing knowledge base and their skills to obtain an advanced degree and move into the role of that independent provider. And as I said earlier, there are many potential opportunities for practice site, and there's a great need for family nurse practitioners.
So you teach primarily clinical courses within the context of an online program. Can you just please tell our audience how that works? How does a family nurse practitioner demonstrate a skill set when the program itself is online? And just walk us through how that works.
Well, our program follows, the same accreditation standards as a, face-to-face program. Students complete 700 supervised clinical hours in the primary care setting. There's specific criteria for each clinical rotation. Students are evaluated by preceptors and by faculty, during every rotation. They also have a one-on-one case simulations that they go through with faculty members. We assess their ability to collect a history, arrive at a diagnosis, and develop a plan of care that is evidence-based. We have health promotion and disease prevention spread throughout the program. The expectations, for our student performance increases as they progress through the program. As students gain knowledge and clinical skills throughout the program all the way until graduation. Our students do have to demonstrate in a live interaction with faculty that they can conduct a thorough history and obtain a head-to-toe physical examination using proper technique. Faculty also work closely with students and their preceptors to identify any additional learning needs. And our students consistently say they feel prepared to enter into practice.
So you, along with faculty colleagues, won the International Blackboard Catalyst Award for teaching and learning 2 years ago. Can you briefly tell us about that and what it felt like to be recognized by receiving such a distinguished award?
Yeah, when our program transitioned online, Blackboard became the learning management system that our program used. The FNP faculty team were proud to receive the Blackboard Catalyst Award in teaching and learning for our design, quality, and performance. So as with many online programs, the majority of the faculty and student interactions are not face-to-face. So it's extremely important to make all those virtual interactions respectful, timely, encouraging, and convenient in order to build that student relationship and that sense of connectedness. The faculty have developed several unique and creative teaching and learning strategies using Blackboard in order to achieve this important sense of connection, not only between faculty and student, but also between fellow students. Our program, the FNP program, we've got highly qualified faculty and instructional designers that are 100% committed to student success. I think we've developed an outstanding program that has exceptionally high level of student faculty interaction and engagement to promote that student success.
Switching gears a bit, I'd like to ask you a question related to the pandemic that we've endured for over a year now. How has this event affected family nurse practitioners around the country, assuming that they've all been on the front lines of this event?
Yeah, right. So advanced practice registered nurses are highly respected professionals, and the resilience and determination has been evident throughout the pandemic. There's not a nursing role that has not been impacted by the pandemic, and family nurse practitioners are no exception. FNPs are often having to adapt to new ways to practice through telehealth options, looking at COVID screening and treatment. There's also been an increase in mental health issues and substance misuse as a result of the pandemic. So as nursing faculty, we continue to devise and adapt our didactic as well as our clinical teaching roles to ensure that our students are well prepared, for the future of healthcare.
How are we preparing graduates for a global pandemic? What do you say to graduates going into these areas?
Well, what we've shared with our students since the pandemic is that self-care, right? You've got to, take care of yourself first in order to be able to care for others. So you've got to be in a good physical, mental condition yourself. So don't forget to practice good self-care so that you can mentally, prepare yourself to care for others. And it's been a challenge for everyone in healthcare, keeping up with, the frequently changing CDC guidelines. But, that's what we do. We're used to looking at evidence-based practice and making sure that we're following evidence-based practice. And it was a little bit of a moving target, because it was something new that we'd never ever experienced before. But that's the nature of the pandemic, that as we gain new information and new guidelines are coming out, then we adjust what we do in practice.
What do you think, Dr. Wood, the future looks like for the FNP field? Will it continue growing, or will there come a time where the market is saturated? What's your take on that?
Well, healthcare, always is going to be necessary, and FNPs are uniquely positioned to provide services across that lifespan, as I mentioned earlier, of all ages. Numbers, continue to say that there will be an increase in need. But, however, it's somewhat driven by population and population health. There may be times where there's a greater need in some areas than in others. But overall, the need for family nurse practitioners will be driven by healthcare. We've got that aging population, decreased number of physicians going into primary care. So we're there to help fill those gaps and increase access to care, good quality care. So overall, the job outlook is good.
Dr. Wood, please tell us a little bit about the rural health descriptor when talking about the FNP program. Does this primarily refer to Eastern Kentucky or what exactly?
Well, when this program was established, it was to meet the healthcare needs of more rural areas, primarily here in Kentucky, because that's where we drew most of our students from. However, rural health applies to any area where there's underserved populations. So that could be in an urban area, such as with the homeless population, or a population that is underserved with any kind of unique healthcare needs. Rural areas in particular, are often geographically isolated with limited access to primary care. Oftentimes, these areas don't have a pharmacy or a hospital. So, rural health focus of our program is really about identifying those factors, those social determinants of health that impact the health of those populations.
Switch gears a bit with you, Dr. Wood. Please share with our listeners a little bit about your personal interest. If you have any spare time in your life, what is it you like to do in your spare time?
Well, as we said earlier, practice good self-care. So my family and I, we have a cabin located in the Red River Gorge area of here in Kentucky. The gorge is known for its beautiful hiking trails, its rock climbing, rappelling, ATV riding, kayaking. So we enjoy entertaining our family and friends at the cabin and sharing all of our hiking and kayaking adventures with them.
Dr. Wood, I believe it's safe to say that nursing here at Eastern Kentucky University is one of the marquee programs. And online, it seems like our faculty have been able to reach a level of engagement with students that is very special, and I would almost warrant to say unique. Could you give us just maybe an inkling about some of the behind the scenes conversations that go into the creation of this very, very engaging level that you and the faculty have been able to achieve with these courses?
So, I think we've got, as I said earlier, highly qualified, dedicated faculty. So we work closely with one another. We're not, in our silos. I mean, it's a team effort. So the clinical person, myself, work very closely with the instructors of the didactic courses to alternate assignments and look at when quizzes and exams fall versus assignments within the clinical course. I mean, it's strategically placed in both courses as they're doing that at the same time, so that they're gaining knowledge and skills and moving forward throughout the program.
Dr. Wood, is there anything else you'd like to share with our listeners? Anything you feel like we haven't touched on today?
I guess I'd just like to say thanks for having me, and to let everybody know that I'm proud to be a part of this Family Nurse Practitioner program here at EKU. We're fully online with dedicated and highly engaged faculty. Students don't feel like they're taking a correspondence course. We have a quality program that produces well-prepared students that are equal to a face-to-face program.
Our guest today has been Dr. Angela Wood of the Eastern Kentucky University Family Nurse Practitioner Program, where she is clinical faculty. Dr. Wood, just want to thank you for your time. It's been a pleasure talking with you and letting our listeners get to know a little bit more about the Family Nurse Practitioner Program here at EKU.
Thank you. It's my pleasure to be here with you, Sam.